Hello, everybody. Today, April 23rd, 2020, the coronavirus pandemic continues. Let's have a quick look at the numbers. 2,656,000 people diagnosed with the coronavirus. 185,000 people died with the diagnosis of being infected by the coronavirus. The most infected countries in the world: San Marino, Belgium, Andorra, Spain, Italy, France, Saint Martin, United Kingdom, Netherlands, Sweden, Isle of Man, Switzerland, Channel Islands, Ireland, USA. What is determining this? It's the number of deaths per 1 million of population, and this is what we have to look at, because if we look at the total cases number, this is giving us a completely false outlook. This is giving us a completely false picture of the situation. Today, I would like to talk with you about Sweden. So maybe not all of us know what is happening in Sweden. So first, I would like to watch a little video with you. This video comes from Bloomberg. Let's have a look.
This long-term thing on the low scale that we do in Sweden is much more sustainable and would not cause these enormous differences in the amount of cases getting into healthcare in the same way. So I think both Norway and Denmark are now very concerned about how do you stop these complete lockdowns in a way so you don't cause this wave to come immediately when you start loosening up. But here we have a lot of trust between the politics and the agency levels, and we keep on having a constant dialogue on what's best to do in the situation we have in Sweden with the possibilities we have here to diminish the impact on public health in this pandemic we're living with.
So this was Sweden. And like you see, in Sweden, they are asking citizens to be responsible. Isn't this crazy? They should put police, military on the streets, force everybody to wear masks, stay at home. But they didn't. Schools are open, restaurants are open, people continue to live their normal lives. So a lot of people predicted that this will end up very, very bad. So let's have a quick look at numbers from Sweden. And then I will show you something kind of interesting. So, worldometer again, Sweden, number of cases, 16,000. Number of deaths, 1,937. Like you see, the number of diagnosed cases is growing slower and slower. But what we really should add is the number of deaths. And look at this graph. Do you see something odd in this graph? I will tell you what it is. So all of those lows that you can see here are the weekends. So it seems that in Sweden, people are not dying on the weekends, are they? So this is a little strange. And then we have this website, COVID-19 projections. If we look at Sweden, we have here this graph showing the death rate. This graph is based exactly, but like exactly on the data from Worldometer, on this. And now the prediction is that the peak in Sweden will happen on May 21st, so almost a month from now, and they will have to deal with more than 250 deaths per day. But if things go wrong, it can even go up to 1,400 deaths per day. And this is a kind of nightmare scenario that everybody's expecting to happen in Sweden, because if this doesn't happen in Sweden, means that we are all kind of crazy, and the only ones who are doing things right are the Swedes. Let's just have a look at the history of those predictions. So here we have the prediction for Sweden from April 11th. So this prediction was saying that the peak will happen maybe April 17th, or more probable April 27th, so 4 days from now. Then the prediction was updated again. But like I'm saying, I'm not saying that this model is wrong. It can be wrong, but I'm not saying that the model is wrong. Probably the model makes a lot of sense, actually, but what is wrong here is the data. And you can have the best model in the world, but if you input the wrong data, the output will be wrong. So why am I saying that this data here is wrong? Like I told you already, this data comes exactly, and you can check it by numbers, from the Worldometer's info. So the daily new deaths in Sweden, we see this graph and we see the numbers. And over here, we have the source. So the source is this website, which is the official website from Sweden showing the numbers. And this graph is showing us the deaths. Let's have a closer look. Isn't it very different from what we see here? It is. And why? So the first idea is, well, the meter is manipulating the data. They want to scare us. They want to show that people in Sweden are dying more and more, blah, blah, blah. Well, this could be true. This could be true, but like they say, don't try to explain human behavior by malice if it can be explained by pure ignorance. It took me a while until I understood what is happening here. So if you look at the total number of deaths reported by Worldometers and the total number of deaths reported by this website, it's exactly the same. But the graph is completely different. So what is happening here? People are dying. The doctor is coming, making the death report. And then it's a kind of bureaucratic procedure, right? The data is coming, but it's delayed. Sometimes it's delayed hours, sometimes it's delayed days. The data that is coming on the weekends is even more delayed. So what we see here is the real data from Sweden. When the diff report is coming, they are attributing the death to the date when the person actually died. So if they receive a report of a person that died 4 days ago, they will put this number bigger. If they receive a death report from a person that died 2 days ago, they will update this number here, and so on. So this number is growing, and let's say that it grows on Monday, Tuesday by 200. Does it mean that 200 people died in Sweden on Tuesday? No, it doesn't. It just means that on Tuesday, they have updated the death data from the last days, maybe the last week. They put all the numbers in the graph. The total number went up by 200, but the number of people who died in the last day can be like here, 5, 18, 53. So 5, 18, 46, 53, 59, 57. So we see this graph here, and we see that the peak happened 8th of April. Since 8th of April, the death rate in Sweden is going down. And right now, it arrived to levels like the very beginning of the pandemic, like the middle of March. They don't die there anymore. So I think it's very important that we all understand the consequences of this. Sweden has not applied any lockdown. The schools have been open, restaurants have been open, streets have been open, parks have been open. Basically, 80–90% of facilities in Sweden have been open. People are on the streets, nobody's wearing masks, nobody's getting crazy over there. Only universities are closed. There are indications to keep the social distancing. They are trying to protect the elder. They are trying to protect people in the risk groups. And they have this idea that young people who are quite resistant to the virus have to live their normal lives, get infected, get resistant, create antibodies, create resistance, and create a herd immunity that will actually protect the society from the virus in the future. And if we look at this graph, I know that today it's a little bit early to say that the strategy has been successful. But I think that looking at this graph, the real graph here, we can be very optimistic about the outcome of this strategy. And I think that every government in every country should look at this and rethink what they are doing. And you can ask why in Sweden the politicians are taking different decisions than in all other countries. And I will tell you why. Because in Sweden, it's not the politicians that are making the decisions. So in Sweden, those decisions are taken by experts, by epidemiologists, not by politicians. The politicians in Sweden, they have nothing to say about what the country is doing. It's the experts making the decisions. It's not the president, it's not the prime minister, it's not the government, it's not the parliament, and it's not the king or the queen. It's the experts. Point. Now it starts to make sense, doesn't it? So I think I've told you more or less everything that I wanted to tell you about Sweden. Now I just want to show you again a few websites that are showing kind of interesting information about the coronavirus. So first we have the Stanford University that says that we have many more people infected with the coronavirus than the numbers are showing, which is good. It's good for two reasons. The first reason is that the real mortality rate is much lower than what everybody is scared about. And second, that we are maybe arriving to the moment that most of people in the society will be immune to the virus. Immune in a natural way without any vaccines, right? We have the immune system that is ready to deal with this kind of shit. One more thing that maybe a lot of people don't realize. The coronavirus is nothing new. The coronavirus is causing infections more or less from September until April each year. 7 to 15% of infections, respiratory infections each year are caused by a coronavirus. Not necessarily this SARS-CoV-2 coronavirus, but the coronaviruses have been around for always. So our immune systems, they know how to deal with this. It's not like it's a virus that appears from outer space and our immune systems are completely helpless. No. So another study, I've already talked about this study. It's the study from the University of Göttingen in Germany. They published the study on April 6th and April 14th. They have published an update. Let me see, maybe we will watch this video here. No, we won't watch the video because the video is in German and it's too long. If you want, you can go to the unigöttingen.de, find this article, watch the video, read everything. I just want to focus here on the results of this study. So the conclusion that they made is that the detection rate, it's around, the average detection rate in the world is 6%. This means that only 6% of people who actually got the virus have been diagnosed. So 94% of people who got sick, who got the virus, not necessarily got sick, but who got the virus, have never been diagnosed. And again, this is good. This is very good. Because in the first column, expected infection fatality rate, we see that in most countries, the fatality rate is below 1%. We can say that it's by average 1%. US 0.96, UK 109, Spain 121, Italy 138. So there are countries where the numbers are higher, but it's 138, it's not 12%. It's 121 in Spain. It's not 10 or 11%. So I will not talk more about this study. I've talked about this already in my first video. The bottom line of this video is Sweden has not applied those very strict measures to fight the coronavirus. The situation in Sweden is, I would say, quite relaxed. The schools are open. Kids are going to schools. People are working. The economy is running. People are walking on the streets. People are going to restaurants, going to shopping malls. They are trying to be careful. They are trying to be reasonable about this. They are understanding very well that we have a virus that is more dangerous than the seasonal flu. But it's not as dangerous as many of us are told to believe. And I would say that over there, they are done with the virus. Look, in 6 weeks, without any lockdown, they are done. While in most of other countries, we are in the middle of this shit. People are scared. People are terrified. People are, running away from each other on the street. My question is, how many people died because they didn't go to the hospital having a heart attack? How many people had a heart attack because of this fear-mongering that is going on all around the media? How many people got sick because they are scared, because they are full of fears, because they are full of stress, because they are terrified? How many people got depressed because of all of this? How many people lost their jobs and are not able to live their lives anymore? How many families are out of money? How many days we will wait with this? How many days? How many weeks? How many days we need for people to not be able to buy food? Because they don't have money. I'm not saying that the food will not be in the shops. So the bottom line here is that the consequences, mental consequences, but also like physical health consequences of the lockdown are much worse than the consequences of the virus. So again, we have, all of us, I think we have to look at Sweden and start to think, start asking questions, and start making conclusions. In Sweden, they say that those numbers are so high because they had a kind of bad coronavirus infections in the group of old people in the social care houses. They say that this is something that should have not have happened, but it happened. So because of this, the numbers are like this. But even like this, we see that it seems for now that in Sweden, they are done with the virus. They don't have to give a fuck anymore. And I will tell you another thing. It seems that the activity of the coronavirus each year is from September, October until April. If this coronavirus is similar to the other coronaviruses, and we don't have any reasons to think that it's not, we can expect that more or less starting from now in the northern hemisphere, the virus will stop to be active. But it will come back. It will come back by the end of September, maybe in October. And it will probably affect many, many countries even more than now. Because now the epidemic started in February, March. We are entering the spring, we are entering summer. In October, we will be heading towards winter. And in October, I would say that 95% of people in Sweden will be already immune to the virus. They will have this herd immunity. They will have this buffer of young people who already had the virus, who are immune to the virus, who are not spreading the virus. And us, well, I really don't think that the stay-at-home strategy, the lockdown strategy, is working. I really hope that experts will start to look at this, that they will start to look at this data, the source data, not this blah, blah, nobody's dying on the weekends data, but they will look at the real source data and make the correct conclusions here. I'm really preoccupied about the world and the situation because I don't remember anything like this. We had a kind of fake pandemic of the swine flu in 2009. But even if the WHO was really pushing the fear-mongering propaganda back then, most of countries didn't arrive to this kind of paranoia like now. In the 60s, 70s, we had a few really deadly flu seasons, the so-called Hong Kong flu. It was much worse than now, really. If you look at the numbers, it was much worse. But we have survived. We haven't made any lockdowns. Seems that pandemic back then was much more dangerous in terms of health. And we have survived. So something here is very, very odd. I think that many of us are asking this question. Now, what is happening? What is going on? Why everybody got so crazy? And if we look at those numbers here, if we look at Sweden, the country that didn't get crazy, we see that getting crazy is not working. So again, I hope that all over the world, the experts will start to analyze the real data and that they will come to real scientific conclusions about this epidemic. And that the politicians will start to listen to experts, to epidemiologists, and that they will start to make the right decisions. And I hope that very soon we will go back to normal, the real normal, and not to the new normal, as some people are calling this difficult to predict future. Well, thank you a lot. Stay well. I hope that I was not very boring. And see you next time.